Memorial Hospital recently celebrated its 60-year anniversary in 2011. Our hospital was established as a not-for-profit organization to provide healthcare services for our community. Over the past 60 years, these services have expanded considerably. We now own and operate over 25 outpatient facilities in addition to our core hospital services. Not only do we provide needed services for the approximate 250,000 residents of Yakima County, we are also the largest employer in Yakima. Our organization is vital for the economic vitality of our region. Our sustainability as an organization has been challenged in the past, but never as much as our current situation. The current challenges are due to changes in the economic environment, reductions in reimbursement, and the rising cost of providing health care. Our organization has been able to innovate and adapt through the years through additions of services in our community, changes in healthcare delivery, and increasing our focus on the business of healthcare. We must continue to innovate and find ways to adapt to our ever-changing environment. The rising cost of healthcare not only challenges our core services, it also impacts the expenses of our self-insured plan. The provision of healthcare benefits has become a significant liability for many employers throughout the United States, including Memorial. In 2012, Memorial's health plan expense was over $21 million. The good news: there is a clear way to help control the rising costs to our self-insured plan to allow us to continue to provide excellent benefits to our employees and their families. A robust wellness program, when developed and administered properly, will provide significant reductions to the cost of care for our organization. Now, I know you might be thinking, we already have a wellness program. Well, this is true, but we have only scratched the surface in terms of best practice recommendations for wellness offerings. And the services that we do provide are not the services that deliver substantial cost savings for our health plan. As a healthcare provider, we are uniquely positioned to take advantage of this opportunity. Better preventative care strategies have been proven to reduce overall costs of healthcare. Wellness programs can be specifically designed to provide this strategy for cost reductions for organizations. Within these programs are specific targeted drivers that impact population segments that contribute to the majority of healthcare spend for an organization. These strategies, when effectively designed and delivered, will provide a healthier, happier, and more productive employee base while controlling costs to the organization. Our organization possesses the intellectual capabilities and physical infrastructure to provide cost-effective wellness strategies to control the healthcare costs that impact our self-insured plan. A wellness program, in combination with proper health plan design, can cut our expenses in the long term while creating a culture of wellness that indirectly provides positive results for all of Memorial services. Our wellness program will reduce costs to the organization and its employees, improve satisfaction through better access and quality of healthcare service offerings, and improve the overall health for Memorial's employees and their families. We will achieve this through three key strategies. The first strategy is Urgent Care Clinic. Our on-site urgent care center will provide access for employees by allowing same-day appointments for their urgent healthcare needs. This prevents typical delays in scheduling that occur in primary care clinics that generally struggle to accommodate this need due to their busy schedules. The service will reduce costly emergency room visits by providing key service offerings for non-emergent and acute care needs. This service will assume reduced absenteeism through a reduction in wait times to be seen in traditional care settings. This service will also help reduce the spread of communicable diseases to patients and employees for a small number of diagnoses that are identified with early and efficient access to a medical professional. The second service offering is CDTM service. Employees and dependents with chronic disease states will have access to services that are not locally offered. These services are called Chronic Disease Therapy Management, or CDTM. The CDTM service will provide one-on-one appointments with expert pharmacists to review medication use, improving overall health and key target measures. The pharmacist will work with the employee's primary care provider to assure continuity of care. The customer will also have access to group educational sessions that will address overall disease state management through various lifestyle choices like diet, exercise, monitoring, etc. Target disease states can be diabetes, hypertension, hypercholesterolemia, chronic heart failure, asthma, and depression. Our initial offerings will focus on diabetes and hypertension due to the potential savings that exist for these two key disease states. Generic medication utilization is our last target service offering. We will offer value to the customer through affordable medication choices with the use of generic medications. Many categories of drug therapy have both brand and generic medication choices, each with similar outcomes. Patients who have affordable medications are more likely to be compliant with their drug therapy, resulting in better health outcomes. This initiative clearly will provide reductions to our healthcare expenses. To quantify this opportunity, I'll discuss the value of each of these proposed services. For our wellness clinic, each visit that occurs assumes that the employee or dependent would have been seen at another location by another provider. The average visit expense for the health plan is about $100. Estimated monthly visits to this clinic will be about $600, with annual revenues of almost $700,000. These revenues are actually an offset of expense that would have been provided elsewhere. It is estimated that 20% of these visits would have been ER visits at an average expense of almost $1,000 per visit. The additional savings to the hospital for ER decreased utilization is over $1.2 million. The projected profitability to our organization for this service is about $250,000 annually. This profitability does not include ER savings or assumed reductions in absenteeism. The value of CDTM services is based on study estimates of cost savings documented in the Asheville project results. Initial efforts for CDTM services will focus on target segments of customers with diabetes and heart disease. Results of the Asheville project that focused on diabetes management realized an overall reduction in total mean medical costs of $1,200 per patient per year. It is estimated that over 400 employees and dependents on our health plan have diabetes. A target estimate of 50% of these patients will be enrolled in the program for an average estimated savings of $240,000. Hypertension benefits are more difficult to estimate, but clearly show value for this service due to the results of the Asheville study. And lastly, generic utilization cost savings. They are based on a focus to increase the use of generics. Memorial's generic utilization rate is 74%. The target rate is about 88%. Memorial dispenses approximately 65,000 prescriptions annually for its employees and their beneficiaries. A 14% increase in generic utilization would equal about 9,000 prescriptions. Using plan-specific historical data, it is estimated that the average generic prescription is about $34 less than branded drugs. The potential savings for this program is approximately $300,000 if the target of 88% is reached. Revenues and cost savings analysis are only part of the overall benefit of wellness strategies. Although unable to measure, other benefits include the ability to recruit and retain quality employees, employee satisfaction, reduced absenteeism, and improved productivity from a healthier employee population. All of these strategies can be implemented with minimal initial capital investments due to our existing infrastructure and competencies. Investment in wellness strategies is not a flavor of the month initiative. It is a long-term investment that requires focus and commitment by everyone in the organization. Success relies on our ability to create a culture of wellness that infiltrates the organization. The profitability that I've laid out for my proposed initiatives relies on our ability to provide value to the customer, our employees, and their families. Profits are only seen when the customer accesses and utilizes our services. Strategies to ensure customer utilization are a significant component of the overall strategy for wellness success. All communications and engagement strategies are desired to create a culture of wellness within the organization. Customers will be engaged and must see value in our service offerings and overall wellness goals. The creation of a culture of wellness is a delicate balance that requires strong customer engagement without alienating our customer base. If the customer feels that the wellness offerings are coercive in nature, we will risk losing a portion of our customer base. The issue of privacy is also a delicate topic that will require effective communication strategies. We will utilize wellness consultants for recommendations on how to navigate these issues. Another key component of the strategy is a strong commitment from Memorial's top administrators and our Board of Trustees. We must visibly show the commitment and support to all of our employees. Leaders throughout the organization must model wellness behaviors and send a clear, consistent message to our customer base. Administration must also commit to the long-term financial investments of our wellness program. Many of the values of my proposed service offerings will not be easily seen in financial statements. Many of these services provide marginal profitability or no reductions to cost seen in these profitability statements. Due to the challenges in our organization, an uneducated leadership team will see the program as an opportunity for expense reduction when times get tough. Upon a formal presentation to administration and our Board of Trustees, I'll ask for a minimum 5-year commitment to expansion of our wellness program. This is an opportunity that we must seize. We cannot sustain the trend of rising costs that we are seeing with our self-insured health plan. As I stated earlier, our ability to innovate and adapt has been a vital part of our success over the past 60 years. We must continue to adapt, and a robust wellness program is a perfect example of an opportunity to embrace a new way of doing business for our organization. Our mission statement is to improve the health of those we serve. Our employees and families should clearly be considered as part of those that we serve. They deserve the same level of commitment that we offer to our core service offerings to the community. We can provide an enhanced level of service for our employees' independence while reducing the overall cost to our self-insured health plan. We must act on this opportunity.